Welcome back to the Cricket Matters podcast. This episode is all about health assessments for cricketers. And I think we're going to keep banging the same drum over and over again, aren't we, James, until people understand. Why does health come first?
Because without health, you have nothing. You have absolutely nothing.
There we go. End of episode. Cracking.
That's it.
Done it.
Have some of that. No, but it's so true. No matter what walk of life we're seeing young cricketers just as much as old cricketers who haven't got basic health nailed down. How do they expect to perform at the highest level if they're not healthy athletes? Right? And I'm referring to the old guys over 50 as well, as much as the 14, 15, 16-year-old kids coming through the pathway. Right? They haven't got the health nailed down. So if whatever aspirations they have of playing at a high level, you're going to struggle, particularly in today's modern game where health, body composition, all these things in terms of athletic performance is such a key factor. And if you want to stand out from the crowd, and if you have two equal guys with equal technical ability, the healthier, fitter, stronger, more athletic athlete will always be picked ahead of the unathletic, unhealthy one time and time again.
Yep, exactly. We did a podcast last week, I think it was, about the right height and weight for cricketers, and obviously that comes under the health, the body composition. Do you want to run through some of the assessments that we do within the health assessments?
Yeah, I think so. There's when we look at health assessments for cricketers, we're looking at four key areas, right? And this covers all the range of athletes we're working with, looking at body, lifestyle, mortality, that's really important for the older cricketer, right? Believe it or not, and then breathing. Those are the four areas we're trying to look at. Now, let's go into a little bit more in depth and go, where do we start? So, more so than anything, we always start with breathing. We want to see how well somebody breathes. People are probably listening in right now going, what the hell are you on about? We all breathe. Yes, we all breathe. However, some breathe better than others. And some of the tricks and tips you can learn from the highest performing athletes is that they can breathe better, more efficiently, get more oxygen into the body than the lesser pros, okay, or the amateurs, is what we call it. So, and also, breathing comes into good health, how it makes you feel, how it makes you recover faster, but also helps you get out of pain. So we do a test, it's a breathing test, right, that helps essentially test the state of your diaphragm in the nicest possible way and how much your body can tolerate carbon dioxide. Now, I don't want to get too geeky around this, and there's probably other bigger science boffins out there going, what? And you're probably thinking, carbon dioxide? We're talking about oxygen. Well, carbon dioxide helps in the process of oxygenation. So the better and more efficient you can breathe through your nose and not through your mouth, the better the uptake of oxygen is into the body to help you breathe better, recover faster, and function better to help you make better decisions, which cricket's all about, making better decisions.
Yep. And sleep better as part of recovery, right?
And sleep better too, yeah, absolutely. So there's a test that we do. We want to see how well and how well you can hold your breath when you've fully exhaled. So the test is very simple. You take a big deep breath in through your nose, fully exhale through the nose, closing your mouth. And when you fully, exhaled, there's no lungs left in the body, you pinch your nose and you want to hold it for as long as possible until the first urge to breathe happens. That doesn't mean until you pass out.
I was going to say, this isn't about passing out and holding for as long as you can. People will know this when they've held their breath. It's like when people have held their breath like underwater and stuff, and you get that little like lump in your throat, you start to feel it. It's that first sensation we're talking about.
Exactly. So you feel it in the back of your throat. You maybe get like a rise in your shoulders, something in your stomach. You often see it. That's when you want to stop breathing. And we'll do a video about this because it's much more easier to explain over video than it is on podcast. So, can you hold your breath after fully exhaling for at least 35 seconds? I was double checking then. So 35 seconds is the gold standard. Anywhere between 25 and 35 is good, but not great. Anything less than 25 seconds, where we see most athletes come, that is a big issue, and that's what we want to focus on first and try and develop their breathing patterns and habits and technique, because it carries over to so many walks of life. And maybe we'll even do a whole blog and podcast episode just about breathing. But that's the first test we're looking at. That's the most important thing we see in terms of that.
What about lifestyle? What do you want to do? Body, lifestyle, mortality? Because obviously that was the breathing, so we've got the other three. What do you want to go on to next?
Well, so a lot of these tests cover multiple aspects of these four components. So let's just go into next where we look at heart health, right? Because heart health is not only a mortality test, it's also a lifestyle kind of test. And what we're trying to look for here now is a lower resting heart rate as best as possible. Now, there are medical exemptions, but on a whole, we want to see a lower resting heart rate because it shows a fitter, healthier athlete with whom we're working with. But also, if somebody, like an older cricketer, comes to us and they have a resting heart rate of over 80, which we have seen in the past, right, that's a time to go and see the doctor. Maybe even get your blood pressure taken at the same time, because that's potential other complications that could be happening that we're not aware of. And that's where we as coaches have to give moral guidance to help say, go and get this sorted first before we can work with you, because we think you're maybe a heart attack waiting to happen in the nicest possible way. Okay, and that's where the mortality side of things first. So we want to look at like active heart rate and resting heart rate. Active heart rate, we do like a 2-minute step-up test. You know, that's something you can have a look at the blog. There's a blog that goes with this in terms of health assessments. But a very simple one is your resting heart rate, first thing in the morning, 2 fingers on your pulse, take it for 30 seconds, times it by 2, and we're looking for, we have like a traffic light system, green, amber, red. So the green is anything less than 55 beats per minute. Anything over 70 beats per minute is in the red zone, and in between is the amber zone. But what we see is that better athletes have a lower resting heart rate. And that's not just from cricketers, but athletes across the world. Subject to a couple of exceptions, but don't think you're an exception. That is very rare that you are in terms of that.
And then lifestyle.
Yeah, like it's hard to quantify lifestyle. There's so many different factors, but what we've done is we've narrowed it down to 2 key elements, and that is how much are you sleeping on average per day, and how much are you walking per day too, because that tells us a lot about you. If you're sleeping less than 7 hours a night, right, on average over the course of the month, and it's easy to track using these, watches, sleep monitors and stuff now, you're never going to perform at your best, which then carries over to maybe a stressful life. Right, other things happening in your life here, and you're never going to perform at your best or train at your best if you're just sleep deprived. Like a whole week of sleep deprivation is equivalent to like being drunk, apparently some sleep studies. So we need to look at this. And likewise, if you're not walking enough during the day and moving, you're moving blood, you're getting lymph to move, help remove toxicity in the body in some respect to recover fast enough, it means you're very stationary or you're sedentary, I think is a better word to put it. May mean you're sitting down a lot, which may mean that you have lower back issues, hip flexor issues, diaphragmatic issues with your breathing.
Diaphragm.
Yeah, because you can't, sometimes these things, you can do all the exercise in the world, but you're not going to fix them if it is a lifestyle issue. So that's where we look at those things. Again, you can see the standards on the actual blog itself. Make sure you go to cricketmatters.com and search health assessments on there, and you'll see the standards. We've listed them all out for you. So these are all our assessments we look at and the standards we want people to adhere to too, so you can compare yourself to others, essentially.
And the other one in terms of mortality, which I really love, is the old sit and rise test.
Yeah, sit and rise test. So there's a great Brazilian study test where it talks about how people get up and down off the floor. They try and sit down cross-legged and stand up cross-legged. And if you wobble, you lose points. If you put your hands down or any part of your body down on the floor, you lose an extra point. The goal is obviously to get 10. But when they did the study with people over the age of 50, for every point they lost, I think it was equivalent to 5 years less life expectancy when they compared it. And this was hundreds of thousands of people they tested this across in this Brazilian data study. And it is really, really uncannily accurate. So we're seeing a lot of not just older cricketers who struggle with this test, a lot of younger athletes too, who sit down all day long. They have the body, they may have the mindset and appearance of a 14-year-old, but they have a body of a 40-year-old sometimes in what we're seeing. So the sit and rise test is part of that longevity aspect with the heart rate. Resting heart rates and active heart rates play a key thing. But then that ties nicely into the other side of things, the body composition things, because that is also mortality in some respects. So we're looking at multiple factors. Yes, your weight and height in terms of performance, comparing it to other professional cricketers. But we're looking at, yes, BMI. Sometimes that's important because there's a lot of studies around BMI. They'll talk about like a lot of health and longevity. Some people say I'm big boned or they have lots of muscle, but it doesn't always correlate to longevity from what we've seen. But to negate all that hassle of having those conversations, debates about BMI, we look at body fat percentage and we're looking at waist to height ratio. And again, like the Brazilian study, there's so many studies around weight to height ratio. That means if your waist is over half your height, so take your height in inches and then your waist in inches, or your height in centimeters and waist in centimeters. So if you measure your waist and it's, let's just say for the sake of it, it's 80 centimeters, and you weigh and your height is 150, that means you're over half, you're over 0.5 in terms of your waist to height ratio. Again, we'll do a fancy calculator for you on the blog so you can see that. But if you're over half, over 0.5 in your waist to height ratio, it is showing that you are at high risk of metabolic disease. High blood pressure, diabetes, all sorts. We can go on the whole list of the whole spectrum there. But if you've got that, no matter what we do with your technical side of things, whether you're strength training, whether you're doing other training, if we're not addressing these issues, you're never going to perform at your best to play cricket well on Saturday. And that is not just me saying this for the elder statesmen, the senior cricketers out there. We're seeing this with kids at a young age. Kids, sadly, are over fat, right? It is just what we're seeing time and time again. They're doing great at technical training, but if they have aspirations of performing at the higher level, they've got to take control of their health as well, because that leads to better performance long term.
Absolutely. And that is why, as we say, health always comes first in terms of our assessments. We will put the link to the blog in the show notes, so everyone can check it out if you missed or are sort of wondering about some more of those tests in depth. And we've got a little interactive bits showing our traffic light system at the bottom of the blog as well. But that is it for today. Please don't forget to rate, review and subscribe. And if you would like our free training plan, then go to cricketmatters.com/train.